Greetings from London. This is Mariam Sharif, and welcome to the Star Moguls podcast. Back for another amazing episode. Now, Dr. Seth Asari is a naturopath with 27 years of experience in his field. He is an expert in cancer wellness. I'd like to welcome Dr. Seth Asari.
Thank you, Marianne, for having me here.
So when I met you at a presentation at the FSB, the Federation of Small Businesses, you were there and you said that you're a naturopath. And so I was like, homeopath. And you said, no, naturopath. So I'd like you to tell us what a naturopath is and what do you do?
Well, naturopaths have been around for many, many years. And in simple terms, it is a modality of treatment that looked at the whole person, that treats the root of the symptoms or the disease instead of looking at the symptoms. It is the program where the body, the mind, the soul is taken into consideration. And also, we normally try to use tendencies of nutritional and lifestyle changes, looking at the biochemistry of the person and not just looking at just the symptoms and giving medication. It is normally using protocols of supplement to help the patient recover quickly. And also we adapt the environment that you live in, the toxins that surrounds you, and try to eradicate them to give you your optimal health. That is naturopathy. Now, naturopathy is not there to work against conventional treatment or traditional treatment. They work in collaboration with them. If you want the best treatment, then it is when you use both natural and conventional medicine.
So how did you get into this field? Because you have a background in finance and accounting.
As a young boy, I've always wanted to be a doctor.
Okay.
School was good. I was doing well until I finished my O levels. And because of shortage of funds, I could not carry on. So it seems like dreams were shut off. And I got an opportunity to travel to UK. And when I came here, because of funds again, I got enrollment to do business, study in business. So in business, I had my first degree in BA in accounting. And I also continue business by studying finance. So I had masters in finance and accounting, international business. Now, I work with corporate companies, but the satisfaction and the enjoyment and fullness of life was still missing. So while studying, I was still undertaking part-time course or online courses in natural healing. I studied acupuncture, I studied massage, I studied nutrition. I did quite a lot until 2013. I finished my doctorate in naturopathy. But why did I do that? Well, when I was growing in Ghana, I saw a friend's wife who was diagnosed with breast cancer, stage 4, have to suffer the treatment of conventional treatment, especially chemotherapy and radiation. And we saw her deteriorating without any improvement, and she died. That was a killer. That was devastating. We lost of this treatment of cancer. So from then, I said, should I finish my doctorate degree? I will seek for alternative treatment that can help eradicate the causes of cancer without these symptoms and side effects and pain. Then along the line, when I came to UK, was the last straw that broke the camel's back. My mother also suffered illness where she was admitted. And before long, they said she was suffering from breast cancer. And so she had an operation where her right breast was removed. When I went home and we had further check on her, we realized that it was not cancer, it was liver cancer. And that was a big blow to us all. I used my specialty in cancer of natural medicine and functional medicine to support her. We could not sustain her because the liver had gone far. And so we lost our mother as well. Because of this painful experience, a friend's wife and my own mother, and I saw traditional medicine were not able to help her in her case. I thought we should give people alternatives when it comes to cancer, where traditional and natural treatment can be combined together to assess and analyze the person's situation and to provide them with treatment that can bring holistic healing to a person suffering from cancer.
That you've mentioned two females. Do you think that cancer is more in females or in males? And what do you see in your own clinic? And who do you help more? Is it men or is it women?
Well, I can say the disease cancer now is pandemic. It is on the rise. According to the World Health Organization, over 6 million people are suffering from cancer. In UK here, there are over 3 million people are suffering from cancer. But in overall, cancer has no respect of who you are. It affects men and it affects women. It affects children, it affects the old people also. However, many men, as in general, will not go to hospital many times. So we don't even know many times when they are suffering. The ones who are very responsive to any illness and treatment are women. We have many men who are coming to my clinic and they are on the increase now of prostate cancer.
Right.
And so men also do suffer, but women in a whole are the one that contract cancer diseases.
And what do you think are the factors regarding more like women getting cancer? What are the reasons, do you think, with females especially?
As a cancer specialist and in my training that I have in functional medicine and on naturopathy, the root causes of cancer are varied and many, but the ones that are most predominant, the environmental conditions that we have around us. Many of us, the environment that we live in and the environment that surrounds us contributes to cancer the most. We are looking at the toxins that we have in the food that we eat and the toxins that we have in the chemicals that we apply to our body, the creams and the chemicals that goes into the food, the manufacturing of them, and also some medication that we take. There are many factors that also affect the gut systems. Many of us, the gut systems are weak. And because of that, the body is prone to many contamination of toxins like bacteria and viruses and fungus, and many of them get inside our body. And when the body are not able to fight them, many of us suffer from cancer. And make cancer, they thrive in the cells.
Is that what a leaky gut is called? Because I hear this term a lot. What can you explain that?
Yes, leaky gut is an old terminology, but it is now predominantly, many doctors are now aware. It is the system where the gut system, there are linings in the gut that is supposed to protect us from having our bodies. But many times, because of the food we eat and the contamination of dysbiosis and bacteria, they get into the body, and the microbiome, the good bacteria that are supposed to be in the body to help us, they are less. And the bad bacteria that harm us are many. Because of that, they perforate in the gut lining. And when this happens, it increases inflammation in the body. And when too much inflammation is in the gut system, then you become exposed to bacteria, and the bacteria thrive in where inflammation are the most. And when inflammation are the most, cancer is on the move to harm us and to spread to all the body
I had
parts.
plantar fasciitis last year, and the first thing that anybody should say to me is that, I think you have inflammation. I think you have inflammation. And just recently, last year, having an episode or a scare, the word cancer in itself is very scary, and people start to fear it and think the worst. And it is, because you do think about every aspect in life, and even though you are intelligent and you can be very practical about it, but your mind does, go overdrive. And inflammation was a big cause. So what other causes are due to inflammation? How do we get inflammation in the body, or more so, how do we reduce the inflammation in the body?
Well, inflammation is not something that drop from the thin air into our body. Our lifestyle contributes to the amount of inflammation you have in the body, but most importantly is the processed food. When we eat or we diet on so much processed food that are inorganic
Mhm.
and contain a lot contain a lot of sugars,
Mhm.
and food that are filled with processed food, and add no benefit to the body, causes inflammation in the body. And when that happens, we become exposed to cancer. Now, inflammation can also be when your sleep, the amount of sleep that you have in your body is less. When you are not having optimum sleep or rest for the body to rejuvenate and for organs and cells to grow, then inflammation seems to uh, increase in your body. It
Yeah.
is not only that, inflammation can be also caused by less exercise. You are not exercising to allow blood to circulate in the body. When
Mm.
that happens, the arteries, the nerves, and the veins, all of them clogs, and the body blood is not juvenating or circulating into the cells.
Yeah.
So inflammation increases. Inflammation can also increase when so much poison are allowed to come into the body. That can also increase inflammation in the body. Now, how can you reduce inflammation? Is very simple. First, I will look at nutrition as one of them. Trying your very best to eat colorful food. I mean, green vegetables, colorful vegetables, and fruits. You can add them to your body, and that can be really, really very important to reduce inflammation. There are some vegetables and fruits that are genetically correct to
Right.
improve the body to heal, to be strengthened. And when the immune system is strong, your body is able to fight off inflammation.
Yeah.
Inflammation can also be reduced when you know the right supplementation and you take them to rejuvenate your.
Dr. Seth, I think you've just diagnosed me completely, because last year is where it started. Plantar fasciitis, I wasn't moving and I wasn't exercising. And I'm someone who does, like, I'm the Forrest Gump of walking, and I do at least a minimum of 10,000, if not more. And that was one reason. And the other reason was that during my whole transition into this menopausal journey, I'm not sleeping. Even today, I haven't slept. I probably slept about 5 hours. And yes, my sleep is like up and down, like a roller coaster. And so I guess you've just named the two that, because I've said to my doctor, my consultant, I said, you know, I don't eat processed. I don't drink. I don't smoke. I have a healthy lifestyle. I laugh a lot. I have a healthy disposition. Why did I get it? Because some people get it, but you've just told me lack of sleep and exercise. because I couldn't move. I physically couldn't move because I was in so much pain. So both factors in this last 6 months has actually just, give like really uh to the point that my body is now producing like cancerous cells, and that was my diagnosis. And so, oh my God, I'm just like having a moment myself here. But what do you think are the foods that we need to have, like the diet that we need to have to prevent cancer in the first place? Can you suggest what we'd be eating as a good healthy diet?
Well, what we eat and what we drink matters the most. When you eat well, you grow well.
Mm.
And when you eat poorly, then your body obviously will not be able to withstand any disease that comes to you. There are some
Do
food
you
that
think
are,
do you think then diet is the most important thing that we have to conquer if we want to be cancer free?
yes, diet is one of the most important. It is not the only important because many people are vegans and they can still have cancer. So
Right.
there are other factors that needs also to be managed. But diet stands out as very important, especially diet that are rich in fiber.
Right.
Diet
Okay.
that are rich in fiber can help withstand cancer cells, and diet that are balanced and rich in minerals and vitamins are very important to fight cancer.
Can you name a few fiber foods that we need to incorporate in our diet, like every single day? What would you suggest?
Yeah, fiber food seems to be very essential, and there are many of them. Many people consume rice, but there are two types of
Every day.
rice.
Yeah.
uh, White rice or processed rice seems to be a problem to those that are sufferers of cancer. But those who eat brown rice or red rice or unprocessed rice can get a lot of fiber. We have something like quinoa.
Yes, quinoa. Love it. Yeah.
Quinoa is very good. We
Yeah.
also have something like millet powder. That is really very good for fiber. So any grain that are less of gluten is
Okay.
tends to be rich in fiber, and that can really help fight cancer cells.
Yes. So what about like bread then? Because that's my weakness. I just love bread, and I because I stopped sugar for the first 2 months of the year. I started eating more bread, and then I started having cheese, and then I went like enormous, and I was like, "What's going on?" And so then I discovered sour bread. Like, what you suggest like with bread? Is it a complete no-no, or can we have bread sometimes?
Bread in itself is good, but it depends on what type of flour you use in making the bread. Some
Right.
bread are gluten free, and they have flours that are organic and
Mm.
not processed. But the one that I recommend is spelt flour, organic spelt flour.
Well,
Organic spelt flour made out of bread seems to be the best out of all the flour. Then we also have rye bread. That
yes.
is what they use to make the sour bread you are talking of. That
Mm.
is also in good. But everything is in moderation. Too much of everything tends to be of a problem. So
Yes.
eating a little bread here and there with your vegetables and fruits and a very small protein or a portion
Mm.
as balanced diet, I don't think will harm you, will be good for you.
So you mentioned the word gluten and then inflammation. What is gluten? What is that? Because I actually never understand what gluten is, because everybody's like, I'm going gluten free. I'm going like I was like, okay, it was such a rage and became the trend word, a good 10 years ago. What is it? What is gluten, and what foods have gluten in it?
Because you have mentioned bread, I will use one grain that causes most of the gluten that we have in our food.
Yeah.
Remember, most of the bread comes from flour made from wheat.
Mm.
Wheat are grains that are supposed to be used by birds,
By
by
birds.
poultry and animals like that. Wheat normally contains a lot of gluten, and gluten is not good for those that are suffering from cancer, and
Right.
also those who are having chronic diseases like blood pressure, diabetes, or weight management, or a woman with hormonal imbalances. So gluten tends to be an enemy to your health instead of adding value to your well-being.
Right. Okay. So is that what would cause kind of bloating? Yeah.
Exactly.
Yeah.
And inflammation. It causes bloating and inflammation in the body. It sort of blocks the arteries
Yes.
and makes it narrow for blood to circulate.
Yeah.
It, it hinders the growth of your cells and your organs. And what is amazing is it is that part which causes tumor most often and add weight to your body, the weight that we don't need.
Mm.
That is where most often it comes from.
Can we avoid chemo if somebody has cancer? And the second part of the question is that if they go through chemo, what should they do afterwards?
As a cancer specialist, and in my time here for over 20 years for working with cancer, I've seen that the best treatment protocol for
Mm.
cancer patients is when we combine natural medicine and traditional medicine together. The integration of these two
Right.
traditions help treat cancer.
Mm.
Now, whilst chemo try to remove the tumor burden from the body, it also extracts quite a lot of good cells and organs and destroys some of them. What naturopath now comes in can also help strengthen the cancer patient by personalizing some nutrition therapy, and supplementation.
Mm.
These therapies, which are very strong in rebuilding cells that are dead, or discriminate them and cleansing them so that new cells and new organs can regrow. And when the immune system are strengthened by taking the right source of vitamins and fruits, it helps one to withstand the symptoms of chemo and to help chemo to do its work properly.
And there's many patients that come to you stage 4 cancer or where doctors have said, um, chemo can't help you anymore. And you've helped like more than 3,000 of your patients. What is the first thing that you do then? What's the first thing you would do that somebody walks into you? What is your process?
Whilst chemo have done quite a lot in the society to save cancer patients, there
Mhm.
are many also who chemo have not really helped as it has really want. Let me give you an example of a patient I can't name because of confidentiality. I'll
Mm.
call her Sarah.
Okay.
Sarah came to me when she has been diagnosed with cervical cancer.
Right.
She went through 17 chemotherapies and still was left paralyzed. She was in pain. She was in agony. She could not sleep. And the doctors have told her that there is nothing we can do for you.
Mm.
Sarah now came to me um, in October this last year.
Okay.
Then, as a functional medicine practitioner and naturopathic doctor, we did extensive research, laboratory tests that help us to understand her history and the root causes of her illness. And after treatment upon treatment and workable solution,
Mm.
systematic approach, personalizing her issues, we were able to understand her and giving her nutritional protocols by lifestyle changes, trying to build her immune system. Sarah now have been given the green flag that cervical cancer is gone, something that chemotherapy could not help. But what I am trying to say is, it's not because chemotherapy is not good. It could not work on that lady. But by combining both chemotherapy and natural resources as a functional medicine practitioner, we are able to give every patient the best of life and the best of health.
So, can you reverse cancer then?
Cancer is reversible when it is detected early enough, and that is for every cancer in every disease. But
Right.
where cancer is left for too late, that makes it very difficult to reverse it. But I can say in my experience, we have had successes where many people that have been diagnosed of cancer now are living cancer-free and enjoying life to the fullest. So
That's
cancer
amazing.
many times are reversible when the right modality and treatment are put in place.
Like you were saying that we can detect cancer if it's earlier on. So what should we be doing? Should we be doing some tests on our body? And what type of tests should we be doing in order to find that? And how often?
Yes, as a functional medicine practitioner, I believe in prevention.
Mm,
I think the most important thing to wait until you test is to live a life that is vibrant. Your lifestyle changes. Like you mentioned about sleep, try to find optimal time to rest the body. A
yeah.
little bit of exercise, eating well and drinking well. But when there is an issue, don't leave it and buy painkiller on the shelf or
Yeah.
buy supplement and diagnose yourself. See a practitioner. For those that have come to me, we have had time to do a detailed research by conducting laboratory tests and
Mm.
trying to come out of issues of the body that have been removed because they responded and came to us. So the best test is report early enough to your healthcare practitioner.
You can't see cancer, especially if it's what's happening in the inside. That's what I'm saying. What do we need to do to test ourselves? Do we just ask our doctor to say we want these tests, or should we find a naturopath and ask them? How does that work?
Um, Cancer is a silent killer. As you said, you can't see and you can't identify them. That is true. There are so many factors that can cause cancer, but it is very important for my patients that have come to me, those that have had cancer or have been diagnosed of cancer, they have had their body now refresh, rejuvenate, and cancer cells does not exist. So by going to a naturopath or a functional medicine practitioner like my private clinic, we are able to assess and determine before cancer even arises, to freak you and to warn you that something is coming. Just like we take our cars to MOT and
Mm.
do servicing. When you do regular check to your healthcare practitioners, that way you will be able to stop cancer from arising. But let me just make this important point. I think one of the most important pillar of cancer is stress. Stress can be managed, but stress, when it is not managed, can kill you secretly without you knowing, especially when stress is left unattended and you are eating well, you are exercising, you are eating well, but stress is killing you. It could be overload, family issues, it could be work issues, financial issues, and when they are not attended, can also let stress take over the body and bring the body down to cancer cells.
Yeah, I guess last year when I was going to see my consultant, that's one of the first questions kind of they ask you, like, are you stressed? And I was like, not stressed than normal. Like I'm stressed the fact that I'm not going out the house or I'm not exercising and that affects your mood. I was like, I'm not stressed, but you never know what stresses you have deep down inside until you really address them. And then when I sat down with them, I was like, okay, there are a few stresses. And you, with a combination of so many things that I get layered, lack of exercise because of the plantar fasciitis, then, the sprain. There's so many little factors of not sleeping and this and like before you know it, you're going down this path of like, which is quite dangerous. And then you have to kind of bring yourself back. Um, I heard that, taking supplements is really good for your body because our food doesn't give us all the nutrients. What do you suggest are like, the top three supplements that we should all be taking to prevent cancer?
Supplements are very, very important.
Mm,
But as a functional medicine practitioner, and in my experience as a cancer specialist, nutrition is the most important call before I come to a
right,
supplement. It is better to eat that which is important and that which add value to your health before we come to a supplement. Now, when it comes to supplements are very essential, and it is a big part of the treatment protocol when it comes to helping those that suffers of cancer. Now, not all supplements are genuine. Some
oh,
supplement contains elements that are toxic to our bodies.
okay,
So
so the supplements could even be toxic.
yes,
Okay,
there are supplements they are not GMO free. They
right,
are
okay,
genetically modified, and they will add even more poison to your body than to
right,
help you. Some of them also have synthetic elements. They are not organic plants, and
right,
therefore the way they produce them can also destroy your body than to help. Therefore, when buying supplement, I think it is very important you get the guidance of your health practitioner, and that
right.
way you'll be able to get the right source of supplement. Now, what you asked me the best supplement to help you, to support you. I think the first supplement that is very, very essential and paramount to your health is vitamin D3.
Okay.
Now, many of us haven't
What's
got
the
the
difference
exposure.
between vitamin? You said vitamin D3. Uh,
It
are
is vitamin D, but vitamin D3 tend to support cancer more. But
okay.
vitamin D in general is deficiency of it causes cancer. Many people, according to doctors and World Health Organization, many people are lacking vitamin D3 without even knowing. And
Mm,
when you are deficient of vitamin D, it suppresses your immune system. It brings your whole bone density down. It gives you, you become tired. You wake up and tired, and your immune system is weak, and everything can attack it. So, vitamin D3 or vitamin D is very important.
right.
The second one is magnesium.
Okay.
Magnesium is such a very important mineral, and many of us don't have the minerals. Which food do you think you eat that will give you magnesium? Many people don't have any clue. So magnesium is really very important to allow many food substances to be absorbed into the bloodstream and
Oh,
to help hormones
okay.
to be built. Otherwise, imbalances of hormone can cause cancer. So magnesium tend to be very, very important to our health.
Should you
Then,
take magnesium with vitamin D? Because that's what I heard, that the absorption of vitamin D and magnesium is a good combination.
very true and
And should we
very
take
true.
it at night then? Because it's not just taking the right supplements, it's also how much we take and when do we take them. Because like there's so many supplements out there. We're like, okay, it's like a minefield. Like, what do you take? Somebody's talking about this or that, and so many that I can't tell you. But So if we take magnesium and vitamin D3, what time should we take it at night? Because somebody said, oh, take it at night. It'll help you sleep. Will it help me sleep?
Yes, for those that are not sleeping well, many
Yeah.
times it could be deficiency of magnesium.
Yes.
But many times, sleeplessness or insomnia can be also the amount of stress that is building in your body. So we are going back to stress again. But
Mm.
you asked the question, how much magnesium should I
Yeah.
take? That is why it is important you visit a healthcare center like Dr.Seth Cancer Wellness, where we take time
Yeah.
to test all the minerals that
Right.
are needed in the body and see what is needed before we can prescribe to you the amount and the type of magnesium or vitamin D that you need to
So we
have
need
in
to
your
get
body.
assessed of course, but what is a general amount that every person or every female should take? Is there a dose?
When you are eating very well and you're eating balanced diet,
Yes.
it seems to me the body is able to absorb or have the amount of mineral that you have. It is only when we are eating imbalanced food or we are not having sufficient, that is when you need. You don't need a vitamin, you don't need to take vitamin D when you are exposed to sunlight every day and you are having exposure of sunlight. You don't need to take because you have enough for the body to help you to grow. It is only when you are in a cold place and
Yes,
you
like
have
the
no
winters.
exposure,
Yeah, like the winters that we
the
have
winter.
in England, and we're all hibernating for like a good 6 months, and when now the weather is nice and we're all out. So is there a dose, is there an amount that we should have?
Yes, about 30 meg seems to be on the average very
Okay.
good for one tablet a day is very good for everyone to manage their health.
30 mg.
Yes, 30 mg.
Okay. And the third one then, Dr. Seth, what you would say? So vitamin D, like magnesium, and the third one?
From my experience, lack of vitamin B can also hamper or cause a lot of diseases to our health. And
Mm,
the B complex seems
okay.
to have all the B vitamin that we need in the body.
Right.
Now, there are times where you can take the B complex and you still need vitamin B6 or vitamin B5 or B2, depending on how your body works. That's why in functional medicine, we personalize the treatment. We
Yes.
don't do one fit to all size treatment or B12 supplementation or protocols that we give. We test, we analyze,
Mm.
and we are able to tell which of them are needed. So the B complex is really very important. But even though you have asked three, I would like to just add one more because it's very important.
Okay.
Remember,
A
when
bonus
someone
one.
go, when someone goes through cancer,
Yes.
your gut system seems to suffer a great deal. And
Right.
for your gut, when it has broken down, one will need to rebuild the gut system in order to build your microbiomes that will help your body. And that is prebiotics. Now, when one suffers inflammation, and sulfur toxins and environmental changes and conditions affect the gut system so much that we suffer from leaky gut or we suffer from immune system suppression. One needs to have a good
Prebiotics.
probiotics
Okay.
to help you build your gut system. It can come in the form of a tablet or liquid
Okay.
or any smoothie that this nutraceutical company can do for you to build your gut system.
Right. Dr. Seth, tell us what you eat. Like, what do you have in the mornings and what is your routine?
Well, my morning routine is very simple and easy,
Okay.
and I can recommend my routine to many of my patients, and they are also in that, and it has helped them. In the morning, my breakfast, if I should eat, is always smoothie.
Okay.
We have a very special smoothie we call Linda Delight, which
And who's Linda?
Linda is my wedded special wife.
Oh, okay.
And the
Wonderful.
smoothie was named after her because she loves it so much.
All
And
right.
she prepares it in so much for our patients that they delight in it, and everybody look forward to the morning food.
Okay, Linda Delight. What is in the Linda Delight smoothie then?
Linda Delight has some important nutrients that
Okay.
is able to combat blood pressure, diabetes, in fact, arthritis and cancer, and especially women with hormonal imbalances. First
Okay.
of
So,
all, there are two of them that are important. One
yeah.
of them is celery, and one
Okay.
of them is also beetroot.
Oh,
And
love beetroot. Yeah.
yes, and there are some special herbs that we put into it that helps you to rejuvenate your body with a good start for the day.
Right. Excellent. Okay, so nice smoothie. Anything else besides like you've given us two, celery and beetroot? Do you want to give us something else that you put in your smoothie?
One of them that is equally good is ginger. We
Okay,
put
yeah, ginger.
ginger in it, and carrots is also very
Carrot.
good. All
Yes.
these things refreshes the body.
Yeah.
It activates and prepares you for the day. It nourishes you because it is less of sugar. It is less of gluten. It is less of it. It gives you power. You don't just become, some people will eat their breakfast and after 2 minutes they will be yawning on the train or driving. But when you take smoothie, you see how I look. Fresh and strength is because I've had my morning delight, Linda Delight already.
Oh, that's amazing. When I was in Dubai, I discovered this smoothie called the Miracle Juice, and that was beetroot, carrots, apple, and that was a little bit of ginger. So kind of the same ingredients, and it was so delicious. I need to start making that again. So thank you for the
Yes.
reminder. Should we be having like three meals? Do we need three meals? And when should be our last meal? Like, do you have lunch?
Yes. Whether you eat two or three is not relevant. What
Okay.
matters is the quality of the food and
Right.
what is in the food. That is more important. Some people will eat breakfast, but breakfast that will contain too much sugar, too much dairy products, and all those things. It has no value to the body. Some people will eat their lunch. Their lunch will contain food that contains chips with too much oil and
Mm,
all these saturated fats. It has no benefit. Some will also eat but eat late. What I propose is that first of all, whilst breakfast is important, it is relevant to put the right type of food. And I
yes.
recommend smoothie. Smoothie either in the morning or in the evening can add value to your health. So
Right.
smoothie to start the day will keep your body strong, and you will be full in such a way that you will not be hungry. So those who take smoothie many times do not take lunch
Right.
because you
Okay.
are not hungry, and
Really?
they will take.
What if I get hungry then? Well, what do I eat?
Yeah, that is your mindset, because you eat processed food, the likelihood that you eat more and become hungry quicker is vast.
Mm,
It is possible. But when you eat organic smoothie that contains vegetables and fruits that are GMO free, many times you get all the fiber and the nutrients, and they are less sugar. The sugars too are natural. It tends to fill the body and keep you energized and helps you
right.
to propel you during the day. The one that I will ask, that those who eat late
Mm,
at night, and they go straight to bed, can be quite dangerous to your health. I suppose because of our work patterns and the
yes.
way we work, those who finish work late, I can recommend that they can take food that are not heavy, something like salad or fruit or vegetables or smoothie. That is better. But it is
Yes.
better when you eat, you don't go to bed straight away. It
Right.
is better to wait and maybe walk around or sit around for 1 hour or 2 hours before you go to bed. But
Yeah.
whether you eat two or three, it is important to eat food that are not processed. Unprocessed food are better. Eat less of sugar and less of fizzy drinks and the rest, and eat nutritious food. Make sure that you add colorful vegetables and fruit to your diet, and
Yeah.
whether it is two or three, you will be okay.
So we had the beach diet, we had keto, we had Atkins, and now we have the carnivore diet. What do you suggest with people who are just eating meat? Is that healthy? And is that better for preventing cancer? Isn't that too heavy for the body? So many people are doing it and losing weight with the carnivore diet. Is it healthy? Should we be doing it or not?
There are so many modality around when it comes to dieting, and many times it is the goal you want to achieve. Now, when people want to diet and you cut down carbohydrates, you are able to reduce weight if that is your goal.
Oh, yeah.
However, for those that are sufferers of cancer, scientists have also identified that excess protein can cause cancer to be severe or the burden of tumor to increase. And in my practice, what I have done for most of my patients is to moderate the intake of meat. And there are times when meat intake has been even zero or nil.
Right.
Whether keto is the best or whether being vegetarian is the best
Mm.
is yet to be proven. Whilst both
Right.
are good, it is very important you have a balanced diet.
Yeah. Okay, that's great. That's good clarification because so many people are eating this carnivore diet and you just don't know like is it good, is it healthy? And but everybody is individual and everybody should
Exactly.
understand their own body. And I think that's what it really boils down to. How I understand it that you should be able to understand how your body reacts to certain foods. If you like it, if you don't like it, if it's heavy for you, your body will tell you when the body actually speaks to you, and if you can communicate with your body, then you will actually live a better life. I knew something was going on with me. I knew something was not right, and so I knew the fact that I wasn't walking, and I've been trying to do it, like waiting for some appointments, trying to do it, and it just and you when you leave it too long, and then it gets worse, and day by
Yes.
day you need to kind of like you can't go back to that same optimal health because it'll take you longer.
Whilst meat is very important, the
Mm.
type of meat you eat is also very essential.
Right.
Remember, so much meat now on the market are genetically modified.
Mm.
They contaminate poison so much so that when you eat more, you reduce weight. But the burden of toxins and poison in your body will be on the increase. There are also meats like pork that has quite a lot of fats in the meat that is not good for the body. So it is very important
Yeah.
in eating too much meat can contribute if it is not organic, if it is filled with cholesterol or fatty oil, that can also hamper your growth. So care have to be taken, and you need a consultant to help you when you are undergoing any kind of dieting.
Yeah, I think that element of the animal being grass-fed or organic really does play a part. And the fact that you know, animals, when we eat them, I feel like awful saying it, but like when they're also caged and when it comes to production, they're not really under the best conditions. If you look at chickens, or if you look, like the way that they are raised and the way that then they are all squeezed together. I've seen these documentaries that are heartbreaking. And then you think that the stress of that animal that takes that stress will go into the meat, and then we will consuming it. So we're
Mm.
consuming, if we look at an energy point of view, we're consuming that animal's stress into our body as well.
Yes,
So it
yes,
all affects us slowly.
yes,
Yeah.
yes, yes. And that is a true picture of the way the animals are reared, the way they are killed, the way they are cooked, the way they are stored. All of them have factors that can go against our diet when we eat too much of them.
So, is there a myth or is there a misconception about cancer that you'd like to put people straight on? Because sometimes we believe something about cancer and then we just, we don't understand it. Is there something that you'd like to put straight?
Yeah, the word cancer is now like a word that no one wants to hear. It's a vocabulary that everybody will want to remove from their mouth. But I am here to encourage everyone who are listening to me that cancer diagnosis is not a death sentence. There is a way out when you have the right treatment protocol, especially when natural health and modern science are combined together with extensive research and care. Personalized treatment, lifestyle changes can bring cancer to a reversible state. So cancer has not come to kill. It is like any other diseases. When the right treatment and protocols are put in place, cancer are reversible.
Yeah, it's really good to know because people, when they think they have it, they think that that's the end and, life is over. So it's a really good way of encouraging people that, just know that it's a diagnosis like anything else and it can be treated and you can recover. And is there anything else that you'd like to say to the audience listening?
You who is listening today, I want to assure you that there is hope for life. If you have a life, you have a family member who is suffering from cancer, or if you have been diagnosed of cancer, or you have cancer and now you are in remission and you are afraid that cancer will come again, there is hope for you. There is hope for Dr. Seth Cancer Wellness or functional medicine where personalized treatment can bring cancer to nothing. We are able to research personalized treatment, try to identify the root cause, have protocols that are provable and scientific that can reduce symptoms and of chemo treatment or radiation treatment and help you to manage your life, have control of your life, and to have your life back. So don't be afraid. Cancer has not come to kill you. Cancer is reversible.
So recently you just celebrated your 60th birthday. What would you say that are three things that you need to do to live a good, healthy life?
There are so many things that one can do to have a healthy life. Healthy life is not just your pocket, but if one can have a stress-free life, a
Hmm.
life where stress is manageable, that will help. So what I do to help me is to build some exercise with my wife where we walk, where we laugh, and where we do things to enjoy ourselves. That is very, very important. We also eat well. We try as much as possible to cut a lot of food that causes cancer, like a lot of sugar, a
Yeah.
lot of processed food. All these, when they are removed from our life, can help us not to. And also to have periodic check to your healthcare practitioner to make sure that anything that your body are deficient of can be given, and that way you will be able to manage and prevent anything from attacking you unaware. These three things:
Yeah.
periodic checks, a little bit of lifestyle changes, including reducing stress by exercising and eating properly, is the key to health.
And a Linda delight.
Yes, of course.
Thank you so much, Dr. Seth, for joining us on the show. And I wish you a healthy, happy, many more years ahead. And Lots of love and laughter always. Thank you so
Th-
much.
Thank you. Thank you. Thank you for having me. Thank you.